Mood disorders are a medical condition. It's not something to be ashamed about, not something we did wrong, not something our kids are doing wrong. When your child is experiencing things like anger outbursts, yelling, crying a lot, anxiety, depression, high energy, low energy, we can categorize these as symptoms that are an expression of their mood disorder. Just like a fever is a symptom of the flu, or blood sugar issues are a symptom of diabetes. So if we can use a factual framework about mood disorders, it can help them and us shed some of the messaging and the stigma that's out there that so many of us absorb and believe that something's wrong with them, wrong with us. So for example, saying to ourselves, my child has depression or my child has bipolar, which is a brain disorder. At times they get sick or their brain gets sick, and when they're sick they have symptoms and they need treatment. Or you can think of it like a broken thermostat. When a thermostat breaks inside the house, it can't regulate how hot or cold the house gets anymore. And so this is kind of like what happens in your child's brain. At times, your child's brain just can't regulate emotions, behaviors, and energy levels properly. And to be clear, this dysregulation, it's not a choice. So often it can also help, especially early on in your child's diagnosis, to look at all challenging behaviors as symptoms. So again, for example, when you see a lot of meltdowns, that's a symptom. When you see their sleep schedule changing, that's a symptom. When they can't get out of bed, that's a symptom. So often it's not laziness, it's not manipulation, it's not defiance, it's something they can't control, and they're not doing this on purpose. So if we can shift our perspective on their behavior from asking, oh, what's wrong with them, or why can't they just, to asking, what's happening? What do they need? What do I need? So for now, consider this. Attitude and approach. When you have the attitude that mood episodes are an illness and need to be treated with medication, therapy, etc., you create space for both you and your child to approach their challenges with more neutrality, love, confidence, and less blame and shame. By reframing our understanding of mood disorders as medical conditions rather than behavioral choices, we can begin to think and respond with compassion, shedding the stigma and growing more empowered. I hope this information was helpful. Feel free to drop a question or comment in the comment section below. Thanks for watching, and remember, you're not alone.